So at your 6-month appointment for your child, you'll get the cleaning and the exam as you normally know. But important things are for example, taking radiographs of your children's teeth, right? The radiographs are important, X-rays are important, because first of all, it shows us if there are cavities. And oftentimes cavities, you can't see it with your own eyes. They're in between teeth, for example, where the floss goes through. That's why it's important to get X-rays. If there are cavities, X-rays will also show how deep is the cavity. If it's a deep cavity, X-rays will also show if there's any infection present. Something else worth noting is that X-rays can also show us, routine X-rays can show us incidental findings. What does that mean? That means basically something out of left field. For example, a child may be missing an adult tooth. Some kids have extra adult teeth. Some kids have pathologies, okay, that sometimes we have to refer to the oral surgeon, pathologies of the bone that we just have to make sure there's nothing malignant about it to just get them checked out, So there's a lot of things that radiographs can show us. Along the same lines, at your 6-month appointment or your regular exam, the dentist will talk about prevention measures. In addition to brushing and flossing, what are some dietary things that can cause cavities? I think the misconception that I hear from parents, especially when I see kids who have a lot of cavities, the parents are like, but Dr. Liu, my son doesn't drink soda, my son doesn't eat candy. But the misconception is that there's a lot of other things that can cause cavities other than candy and soda. For example, starchy foods, breads, crackers, things that can kind of like stick to your teeth, raisins, gummies, things that are sticky like that. Those are all things that are what we call in our field carcinogenic that can cause cavities.